How do monoclonal antibodies treat B-cell lymphoma? Imagine a highly trained team of guided missiles targeting only the enemy cells in your body. That's essentially what monoclonal antibodies do when treating B-cell lymphoma. These lab-made antibodies are designed to recognize specific proteins, called antigens, on the surface of malignant B cells. In many types of B-cell lymphoma, a protein called CD20 is present on the cancer cells. One of the most well-known monoclonal antibodies used is Rituximab, which binds directly to CD20. Once Rituximab attaches to the cancer cell, it activates several immune mechanisms to help destroy it. One way is through antibody-dependent cellular cytotoxicity, where immune cells like natural killer cells are attracted to the marked cancer cell and kill it. Another method involves activating the complement system, a group of blood proteins that form pores in the cancer cell's membrane, causing it to die. Sometimes, the antibody binding itself signals the cancer cell to undergo programmed cell death, called apoptosis. These processes work together to reduce the number of malignant B cells in the body. Beyond targeting CD20, other monoclonal antibodies can recognize different proteins on lymphoma cells, such as CD19, CD30, CD52, and CD79B. This allows doctors to personalize treatment based on the specific markers present on a patient's lymphoma cells. Some antibodies are linked to chemotherapy drugs or radioactive particles, creating targeted delivery systems. These are called antibody-drug conjugates or radioimmunotherapy. For example, Rituximab vedotin targets CD30, delivering chemotherapy directly to the cancer cells, while Rituximab tioxetin carries radioactive particles to deliver localized radiation. There are also bispecific antibodies, which are engineered to bind both a lymphoma cell and a T cell, bringing immune cells into close contact with the cancer and stimulating it to kill the tumor. These therapies are usually administered through intravenous infusion and are often combined with chemotherapy to boost their effectiveness. The use of monoclonal antibodies has significantly improved outcomes for many patients with B-cell non-Hodgkin lymphomas, including diffuse large B-cell lymphoma and follicular lymphoma. While these treatments are powerful, some lymphoma cells can develop resistance over time. Researchers are continually working to improve these therapies, develop new antibodies, and find better ways to combine treatments. Overall, monoclonal antibody therapy is a targeted approach that harnesses the immune system to recognize and eliminate cancer cells, with the goal of maximizing effectiveness while minimizing harm to healthy tissues. It's important to remember that treatment decisions are personalized, based on the specific characteristics of each patient's lymphoma, and should always be discussed with healthcare professionals.